Hello, everyone. My name is Candace Smith, and this is Pasco Connect Magazine Community Talk. I'm so excited to be here with Pasco Young Revolutionary's president, Marlowe Jones, and he has a special guest with him today, Nathan Ohihoin. I pray I pronounced that right. Thank you so much for being here today. I've learned a lot about you in some conversations speaking with Marlowe and some of the things that you do for the community and some of the services that you provide. So I'm excited to learn more today, and I'm excited for the community to learn more as well.
Thank you for having me.
No problem. Marlowe?
I'm on mute. Let me take myself off mute. Thank you, Candace, for hosting this and putting this together for us. And thank you, Nelson, for being able to come and be a part of this. First and foremost, thank you so much. First thing is COVID-19, as we know, have been really been a topic of conversation for the past year, almost 2 years, that we seem to be in this pandemic. And we know now close to 200 million people have been vaccinated, and they're trying to get more people vaccinated each day. Nelson, can you tell us a little bit about yourself and what you do and what you've been doing so far with your pharmacy and COVID-19?
My name is Nathan Ohihoin. As has been introduced, I'm a pharmacist. I've been one for, I would say, just over 30 years now. It's been a long journey. And my background is a pharmacy with masters in microbiology. Practiced pharmacy in Nigeria, way back in Africa. Then I went to Europe, specifically Germany, to do my master's there and practiced there for some time before coming to the States to work for Eckert Pharmacy and later CVS, and I opened my own place. Basically, what we do, what I have always tried to do, is bring pharmacy to the community. I know the big chains are popular, but I don't think there's that personal touch associated with them, having worked with them for quite some time. My pharmacy, Green Apple RX Pharmacy, what we try to do is bring pharmacy services closer to the community. There's that personal touch. You come into our pharmacy, it's very, very comfortable. You're not standing in line waiting for any of our services. We have a bar, not for alcohol, mind you, but a reading bar where you can sit down and go over literature while you wait for your medication. We also have comfy seats where you can sit down. And our contribution to this, to the pandemic, is that for just about a month now, we've been making available vaccine services for people who want to have vaccinations against the COVID-19 virus. We provide vaccine services, and just give us a call, schedule an appointment online through our website, gapplerx.com, and we set it up. It's quick, it's fast, it's easy. Like I said, you go to the CVS's or the Walgreens, you're standing in line, it takes hours, but yeah, in 5 minutes you're done. So that's what we've been trying to do for the community.
Okay.
That's awesome. That's really awesome. I do notice one thing when I'm, walking into the stores or Publix's or the different pharmacies, they're very packed with people waiting to, get that vaccine. So that's a good thing that you mentioned that, if you come to yours, it's relatively quick and in and out process. You don't have to be there all day waiting, possibly making yourself more immune to getting COVID with all those people that seem to be congregating in Publix's and stuff like that. Do you have any questions you'd like to ask, Candace?
I do.
Go right ahead.
So it's really good to see that you're a Black pharmacist. What are some of the things that you feel like you can offer Black people, as being a Black pharmacist, that maybe they can't get in other places?
That's a very good question, actually. We have special discount programs for people who can, for some reason, not afford their medications. Mm-hmm. We have a program that's called We Care Options. Mm-hmm. Actually, what it does, it's like an in-house health plan. It covers both primary care, because we have a clinic next door called Port Richey Health Center, and the pharmacy, and we do labs. And that's why I talked about the personal touch. I make all the decisions are made at a personal level. If you go to a CVS or Walgreens, right, you need a medication, you have a prescription, the price is fixed. It's done, it's done. Nobody's going to change it for you. But I've had situations where people come in and explain to me their situation, and we give them a discount. We even had a situation where patients could not afford to pay their medications. And what we did, we gave them at cost. Because for me, primary care, which is an area I focus on, is very important, especially for the Black community. Majority, I would say 90% of healthcare costs goes into the chronic conditions, which affects the Black community disproportionately. Talk about blood pressure, you talk about diabetes, you talk about high cholesterol and stuff like that. These are medications that you can easily get into our program, and you're getting a month's supply for less than $5, you know? So that is something we think we can bring to the community, but we just have to get the word out there. But another thing that's very important too is that because a lot of people in the African community, sometimes the African-American community, don't have health insurance, they are scared to go see a doctor. And because of that, things start to pile up. And by the time something happens, it's too late. They have to go to the emergency room. Healthcare costs have gone up. They can't afford it. So what we are trying to tell them is that it doesn't matter if you don't have a dime. Come to our center, talk to us. We'll make sure you get that care. And if you're on your meds for your blood pressure, for your high cholesterol, they are easily affordable. And if these conditions are managed, it's not going to get to a situation where you have to go to the emergency room, or you get into the situations where it's too late and God forbid something really bad happens. And so that's the kind of service we do provide for the community.
I love that. I think that's really important because, like you said, a lot of people are afraid. You know, there is that fear, or that just put it on the back burner. You know, I have more important things to take care of. And, you know, sometimes when you go to other places, they're not necessarily going to take that extra care to say those things, you know, but we can kind of talk to each other in that way and say, hey, you got to stay on top of your health. You got to stay on top of taking your prescriptions, making sure you get your medications on time, making sure that you're taking them correctly, eating correctly. I feel like we don't have enough of those types of conversations. So I just consider your establishment a gem, you know, to have in the community, to have somebody that really is, because that is a big deal. And it is the difference between a lot of Black people dying and living. Our mothers, grandmothers, aunts, a lot of time Black women, you know, Black men as well, you know, not getting the proper care. And so to have somebody in the community that can care enough to make sure that that's being done is just everything. So I'm very appreciative of what you offer to the community, for sure.
Thank you. Yeah.
Yeah, so I would really like to see about doing some initiatives to, you know, get more people coming there, because they will probably get better care by getting their prescriptions. They will get, you know, some good information, you know that their questions get answered correctly, because sometimes my experiences has been going to pharmacists not feeling sure because I was rushed out of the doctor's office. And so now I'm trying to get good information from the pharmacist. And sometimes they don't care enough to give good instructions. They're just move out of the way, you know, and that's the level of care a lot of Black people receive. And that's a real thing. And we wonder why, you know, why is it disproportionate? Because there is not a level of care. So to have somebody there that really cares is a big deal to me. So, yeah.
Yeah, that's correct. And one thing I want to mention too, and people always say this, I know that it's sometimes it's cliche, but it's actually true that when for a Black man, especially like myself, and a primary care physician in the clinic happens to be a Black man too, it's very, we feel it. We know what it is as a Black man to go through certain conditions, certain health conditions. And for us, we feel more comfortable talking to somebody we know or we feel can empathize with our situation. That is, I just feel more comfortable that way. And I always tell people too, when I go and give out some talks, and it was not until recently that, for example, high blood pressure, which we call the silent killer because you don't really feel anything, that some medications that are used for high blood pressure, we've discovered that some particular ones seem to work better with Black men, for example, than Caucasians, and the reverse is the case sometimes. So that's what we mean, that a lot of African Americans, a lot of Black folks, I have a history of high blood pressure, and I know what works for me, because I've tried and tested a bunch of other stuff. So it's very important that we don't take these things for granted. And the good thing also is that all these medications, they are really, really affordable and cheap. It's nothing really. $2, $3, you can get them. And like I said, we can always work with you. So feel free to come. I'm always available to give talks anywhere when I have the time, just to spread the word. It's very important for our community.
Okay. Well, that's good to know, because I'll definitely be reaching out to you when the opportunity presents itself. Because like I said, these conversations just can't happen enough. And so, once people just continuously know that you're there and that you're available, I believe that more will come. And so, I believe opportunities will definitely present itself in the future, for those things like that to happen. So thank you once again for, joining the community talk. Can you give your contact information and address and things like that?
Yes. Green Apple RX Pharmacy and Port Richey Health Center. It's 6506/6508 Embassy Boulevard in Port Richey. And check out our website, gapplerx.com, or call us 727-261-4684.
Okay, perfect. We'll make sure that's in the description box as well.
Thank you.
Awesome. Thank you so much, Nelson, for coming on and, talking to the audience about the importance of vaccines, and, that you are actually doing this. I think it's awesome. I've lived in Newport Richey all my life, and I don't think I've ever seen a Black pharmacist, let alone had one. To be honest, my friend Greg, he's Hispanic, he just became a pharmacist about 5-6 years ago. But other than him, I don't even know too many people of color in general. So it's nice to know that we have someone in our corner that actually cares about our community. And I know you've been doing a lot of stuff in the community. Do you want to talk a little bit about what you've been doing in the community?
Yes, actually, I'm out of the restaurant business now, but I used to own a 5-star restaurant in downtown Newport Richey. And another thing I'm passionate about, I'm a board member of the Good Samaritan Clinic, which is in Pasco. And we do provide medical services for people, but those people have to absolutely have nothing. They have to go through a vetting process and provide services for them, free medical and sometimes free prescriptions also. So those are some of the things we're doing, and we hope to contribute more to the community. I have actually spoken with you about the possibility of organizing vaccine clinics. Instead of people coming here to the pharmacy, we host those clinics at specific locations, so maybe an African-American church or the African-American Center, and so that we are bringing vaccines to the people, because it's absolutely important that we get vaccinated. We lag behind in vaccinations, especially against COVID. And so I believe that coming to the community, and especially sometimes our people want to get the vaccines, but they can only go do these things after work because they are working almost the whole day. So by the evening, your traditional pharmacies are closed. They are not doing vaccinations anymore. So that is something we can easily do, that we can say, hey, listen, 5 p.m. to 8 p.m., we can come set up anywhere and get people vaccinated. Something I'm very passionate about, and it's something hopefully we can push and bring to the community and get as many people as possible vaccinated.
Oh yes, most certainly.
So I have a question about the vaccine. I feel like for some people there's hesitation because of a fear, of the government and, in the past, Black people just have not felt safe about receiving certain things like this. And so, I've spoken with a lot of different people and they may not ever say it, to anybody, but they're really afraid because there's a mistrust. So do you have any reassurances that you can give people that what they're injecting in them is safe and that it's better for them to do this versus not doing it?
Sure. I know because of the history, we have vaccine hesitation in the Black community. But this vaccine is extremely safe. I have had mine. I had mine back in January and I'm still kicking. So that's proof there. And secondly, what I always tell people is that the way the vaccines have been made, the technology behind it. Now, traditionally, vaccines are made using either a piece of the virus, for example, or what we call or a dead piece of the virus, or a dead virus. What happens is that they put it in you and your body produces antibodies to fight against that virus. So you're essentially tricking the body into saying, hey, there's an attack coming, let's go after it. So that's what happens. With the new method, what's actually happening is that we're using what we call the mRNA to get the vaccine. That's what really gets into people and stimulates the production of a protein. So it's absolutely safe. So when I tell people that vaccines are actually safer than medications, because what the vaccine is doing is stimulating your body to produce its own defense mechanism, the antibodies to destroy the virus. So, and we've had the vaccine now for a few months, and so far results have been excellent. Side effects have been extremely few. And somebody came into the pharmacy once and said, hey, listen, I want to wait a little bit because the vaccines might not be safe. You guys, we might see people dropping dead. I say, listen, most healthcare professionals have taken the vaccine, right? So if we all die, we have a problem anyway. So that's what I tell people, that your healthcare professionals have mostly, I would say close to 90%, if I'm not wrong, have taken the vaccine. And we feel pretty confident that it's safe. So there should be no fears, there should be no hesitations.
Okay, perfect. Well, I do think that is very reassuring to hear.
I do have one question. What is your comment on the Johnson & Johnson vaccine and the pause of it and then the revamp, the re-go? Do you have any comment on that or anything?
Yes, I think the Johnson & Johnson vaccine, there were issues with blood clots, which were extremely few. I think personally, from my point of view, I think the CDC probably overreacted in pulling it from the shelves and not giving it to people. I'm happy that it's back on now because it shouldn't really have been pulled in the first place. The cases of blood clots were really, really minor. I mean, they were really, really few and far between. And I don't think there was any difference between the incidence of blood clots for people who took the vaccine and the general community. But that's the problem again, that because people are so apprehensive of the vaccine generally, that the government or the CDC, the authorities, they try to cover all their bases, and because of that, they probably overreacted to those cases. So that's what happened. So Johnson & Johnson is perfectly safe to take. I don't have it as at this time. I carry the Moderna, but it doesn't matter. Whatever vaccine you're getting, what I tell people is this: if I have the opportunity of getting a Moderna today and a Johnson & Johnson tomorrow, I will take the Moderna today and vice versa. So it doesn't matter. All three vaccines that have so far been approved, Pfizer, the Moderna, the Johnson & Johnson, they are all safe for use. So get them as soon as you can.
Okay.
Okay, awesome.
Yeah, I feel better talking to you about it, honestly, because, you know, talking to different people, you hear different things on the news, and then you already know you can't really trust, you know, the government and healthcare professionals sometimes. So, you know, that's very reassuring. That's very reassuring, and I feel like it'll be reassuring to a lot of people as well. So we'll definitely post your information in the description box to make sure people are aware.
Appreciate that.
Yes, thank you so much, Nelson, for taking the time out of your day to speak with us and speak with the people that will see this and listen to it, and hopefully come into your facility and get vaccinated and start taking it more serious, because we as African Americans, like we've all stated, we're really behind on this thing, and it's affecting us more and more each day. We're seeing, you know, the people that are dying from it predominantly are African Americans and people of color. So it's nice to talk to someone who has education on the subject, and, you know, we could get that information to the public. So thank you.
Thank you, guys. Okay.
All right. All right. Thank you, Candace.
Yes, thank you so much, Pasco Young Revolutionary's president.
Thank you. Thank you. Thank you very much.
Jones,
Okay, take care, guys.
And thank you, Nelson. All right, y'all
Okay.
have a great day. Peace.
You too. Bye-bye.
You too.